Today we are going to talk about a multifidus contraction to help with capsular entrapment. What on earth does that mean? Stay tuned. Basically, if you pinch a capsule joint in your neck by extending, side bending, or rotating a little bit further than what your body felt comfortable with, you can pinch a capsule. That can be irritating to your neck. It can be a sudden onset while you were stretching or just moving, sleeping wrong, things like that. And so you can try activating the same side multifidus muscle, which is a muscle that attaches to the capsule, and see if it works. See if you get instant relief or something close to it. Okay, you guys, so here is a little bit of a cervical spine or neck joint lesson in biomechanics for you. So the way that your neck works, it has two kind of arms. So if you think of my body as one vertebrae, it's gonna have two arms and two legs. See if you can see this. So the legs are going to attach to the body below, the vertebral joint below, and the arms are going to attach to the vertebral body above. These arms, and like my feet, where they would attach, when my arms touch the feet of the vertebral body above me, where the feet touch the hands, that is going to be called a facet joint. And facets glide and rotate and bend backwards as your joints move, okay? So around a hand grabbing a foot, like your hands grabbing the foot, think of like two people above me. So these feet are going to be touching hands below me, and that's how your vertebral bodies stack on top of each other. So the hands that touch the feet around them, that surrounds them, is like a balloon-like structure called a joint capsule. And that helps keep the synovial fluid, or just like the lubrication fluid, so that these joints can glide on each other easier, more efficiently, with less pain. It also helps to make sure that the cartilage on the bony parts, that stays, good, and it doesn't kind of grind down. So it's just a lubrication. It decreases the friction as they glide on each other. So if you think of my hands as those facet joints, if you side bend this way, my right side, or this side of my body, those joints are gonna go down, and the left side of my body, those joints are gonna go up. So this is how side bending works. And then if it goes to the other side, these joints are going to go down, these joints are going to go up. On the down sliding, these joints are going to compress, and these joints are going to open. So the space between these joints that go down or slide down is getting smaller, and the space between the joints on the top are getting bigger. We call the down joints close packed and the top joints open packed, just based on how much space is between the joint surfaces. So when you side bend sideways, or when you side bend, the bottom one closes, the top one opens. When you bend backwards, both slide down. So both joints slide down, and so both joints, when you extend backwards, are in a closed packed position. When you bend forwards, both slide up and are in an open position because they're located on the back. So when you bend forward, there's going to be more space here. When you bend backwards, there's less space there. So you can kind of see that when you rotate, the side you rotate to, you can kind of feel it. This side closes, this side has more space, is more open. So same thing, if I go this way, go to the right, my right side joints are gonna close, my left side joints are gonna be open. So, say you're stretching, like I had a friend talk to me a little bit about something she experienced recently. She was extending and she was just kind of stretching like this, and she felt a pinch in the back of her neck. That was fairly painful. She really had a hard time moving her neck after that. One of the things that it could have been was that as she was sliding backwards and both those joints were going to a closed pec position, that capsule got pinched between the joint surfaces. Again, that capsule is that balloon structure that is on top of the joint surfaces. It could have kind of snuck up in there, gotten pinched. That's painful. There's nerve endings in that area. Painful, and then created inflammation in that area. And then it can just kind of continue to be kind of stuck and not move. So a lot of times then what happens is you don't want to close that space off. So if you've pinched something, so let's just for conversation's sake, say that I pinched something on my left side. So I'm not gonna want to bend this way. I'm not gonna wanna close down that left side. I'm not gonna wanna bend backwards, and I'm not gonna wanna rotate to the left side, because all of those positions, rotating to the left, side bending to the left, and extending, are all going to make that joint that's pinched even smaller. So what I'm going to want to do is actually potentially open that space. So I might see myself rotating away and kind of side bending away from that space, and just kind of holding my neck like this because it feels better because it's more open. So one of the ways that you can try to kind of pull that, pull's a little bit of a harsh word, kind of try to encourage, gently pull that capsule out, is by activating the same side multifidus muscle. So multifidus is just a fancy word for a really little muscle that attaches to the joint capsules on the same side. If it is the left side, you're going to pull towards your right knee. So you want to engage this extension and side bend motion. So it's kind of a diagonal this way. So if I'm pulling towards my right knee, I'm going to side bend and extend to resist that motion. So it's gonna look like this. If I'm pulling this way towards my right knee, I'm going to extend and side bend away, trying to activate that left multifidus muscle. You might have to do this in a couple of different positions, especially if you're already struggling with trying to get your head in an upright position. You may start off here. This might be as far as you can go. That's totally fine. You're going to extend and side bend towards the side that is painful for you. Hold for 5 seconds. Relax. See if you can get a little bit further upright. If you can, awesome. If you can't, try 4 times. Trying to activate that left side muscle again. If you're having a really hard time doing this on yourself, maybe your shoulder mobility is not there, you could also have someone gently kind of try to push your head towards the right, or you can kind of lay down and push into a pillow or into your bed, something that's going to stabilize your head. What you don't want is for your head to really move too much. It's an isometric contraction. So I don't want to pull my head down and to be moving through the motion. I want my head to be steady and to be pushing against an equal force in my hand or in that object, if that makes sense. So that is how you would contract the multifidus muscle on your left side if you were having left-sided neck pain. If you had right-sided pain, it would be the same thing. You would just tilt it away. You would go to wherever you can, the farthest motion that you had. Do the opposite hand. I would be pulling to my left knee in this direction, and I would be extending and side bending towards my right side. Holding for 4 to 5 seconds, relaxing, seeing if I could come up any further. extending, side bending to the right. And again, side bending is this motion where my face is forward and I'm just tilting my ear to my shoulder. Now, this isn't gonna necessarily instantaneously solve all your problems. You're probably still gonna have irritation in that area, inflammation in that area, and so you're gonna still have to kind of just be gentle, kind of do some self-massage to that area, heat if it's after 48 hours, relaxation. I hope you guys found this helpful. Feel free to like this video, subscribe it, share it with friends, anyone you know who's having neck pain. Again, post any questions that you have, so body parts, stretches, strengthening, muscle groups, anything like that, pretty much anything you would ask a physical therapist. I would love to do research and film a video for you guys so that you have answers to all your questions. Check out the description below to work with me in all the capacities. I do online fitness groups, and then I have a website as well, and an email list where I talk about all the ambitious, random things I'm doing, like creating a children's book and things like that. So I'd love to get to know you guys more personally in the online space, so make sure you connect with me through my website and on Instagram. Bye.